Intravenous therapy, or known as IV drips, have been widely used in China since the 1950s. And now, 60 years later, hospitals are packed with patients seeking out the treatment. But as Jing Qiao explains, some have begun to ask whether the use of IV drips should be squeezed out.
Transfusion frenzy. From Beijing to Yunnan, transfusion rooms at hospitals across the country are overflowing with patients, sometimes with literally nothing more than a common cold. Patients of all ages have become convinced of the IV therapy's health benefits.
It's like a 3-ingredient soup with antibiotics, vitamins and hormones. That's the kind of infusion patients like to receive the most, and it's quite common.
While patient demand for IV drips has soared, doctors have also not been holding them back. Still, some experts have questioned whether IVs are really worthy of all the trust that's been put in their curative powers.
I think it's bad practice. It's hard to believe that the transfusion room is crowded with so many people.
According to China's Food and Drug Administration, IV drips are actually a high-risk treatment delivery method. In 2012, 53.5% of adverse drug reactions around the country were related to IVs. That's compared with just 2.7% coming from injections directly to the muscle. So while IV drips may be able to treat a cold, it still may not be the best path to long-term health. Jing Qiao, CCTV.